Hi everybody, it's Christopher and welcome to Life's Not Over, It Just Looks Different on YouTube. In today's video, I want to talk about something that I touched on in a previous video and I want to go deeper into it. And that is the need to advocate for kids with CVI, but also for working age adults like myself, and even for older adults who lose their sight as a result of a stroke. Back when I lost my vision in 2005 and after it was identified, the neurosurgeon said to me, we'll just have to wait a year and see what you get back. Really no help at all. The occupational therapist in that same hospital came to me on 2 different occasions, did a test with me. The first time she showed me a wooden letter. It was about a foot tall. She showed me that, and I wasn't able to tell her what letter it was until I could trace it with my finger. And she came back another time a few days later. She did another test with me. She showed me this time something was printed on a full letter size sheet, 8 by 11 sheet. It was the full size of the page. And she said, can you tell me what letter is on this page? And again, I could see that there was something there, but I couldn't tell her what letter it was until I could trace it with my finger. After that, I never saw her again. And yes, I got a referral to CNIB, the Canadian National Institute for the Blind, but at no point did they offer any programs or therapy or anything. Now, if the stroke that I experienced would have affected my arm or my leg or an entire side of my body, as it does for some people, I would have been referred to all kinds of therapy and everything else to try to help me regain use of that arm, the leg, or that side of my body. But for vision, it doesn't happen. It's almost like the medical profession. They don't say this out loud, but it's almost like they say, you lost your sight because of a stroke? Oh, that's a shame. And this conversation ends right there. So that needs to change. So in my role now, in my day job, when I'm working for Canadian National Institute for the Blind, and I'm out there in the community and talking to people, anytime I'm in front of a medical professional, be it a family doctor, an occupational therapist, a physiotherapist, a specialist of any sort, I'm very enthusiastic and very emphatic on how vital a role they play if they have a patient who experiences sudden sight loss because of a stroke or anything else really, any sort of brain injury that costs them their sight. They play a huge role, especially in those first couple of years, because reading information about neuroplasticity, the consensus seems to be that there's a lot of really prime time there that in those early days when recovery is possible if we get on it. And I think that is exactly what I experienced, because even though the hospital didn't recommend anything, as I've mentioned in a previous video, with the help of friends and family and my spouse, we came up with things that I did and tried to improve my sight, and I believe it helped. So we did that. But I can only imagine that it could have been even better, hopefully, maybe not. But there's a chance that it could have been even better if we'd have had some professional intervention to help me with strategies and programs to help recover it, much like they do for body parts. So that part is really super important. And then I also tell them about how important it is to connect that person, that patient of theirs, with a psychologist, a counselor, a psychiatrist, or somebody, because that is also vitally important. The programs and the referral to CNIB and everything, those are all well and good and wonderful. But there's an emotional aspect. The person has to grieve the person who they were. They have to grieve that they can no longer do some of the things that they used to be able to do. So that part is also hugely important. And so when I'm out in the community and I meet people, these are the kind of things that I share with them that I really think they need to consider and they need to look at. Also, with my optometrist and my ophthalmologist, I also express to them how important it is to at least know about CVI and know about it, be aware of it, know what it is and how it affects a person. I know that it's an eye thing, and CVI is a brain injury, so I don't expect them to necessarily have the strategies to treat it. But I want them to be aware of it. And my own ophthalmologist, I had a great ophthalmologist who seemed to be aware of it and was very open to talk about stuff. And, you know, he was really great. But he moved and I was no longer able to see him, so I had to see a new ophthalmologist. And with the new ophthalmologist, right from the start, I asked him, what do you know about CVI? And at the start, he told me that he knew little to nothing. And in subsequent visits with him, I see him about every 6 months, and in subsequent visits, I would ask him, have you been reading about it? Have you been learning about it? I'm kind of a bug that way. But I wanted him to at least read about it and know more about it. Finally, earlier this year, back in about September, I saw him again, and this time I asked him again. I said, have you been reading about CVI? Have you been learning about it? And he said that he's more aware of it, he knows it's a problem, but he doesn't know how to fix it. And to me, that was a win, because I wasn't asking him to fix it. I just wanted him to be more aware of what I'm experiencing, how it affects me, and so that we can sometimes have that conversation. When it comes to fixing it, I think we're looking more towards the world of neurology and people who work in that field, because it is a brain injury. I think that's where the help needs to come from. Them in conjunction with occupational therapy and physiotherapy. Those disciplines could help to make this better for patients who experience sudden vision loss. The other reason advocating for this is really important to me is for kids. Now, kids right now, they're getting, many of them are getting great help from pediatric ophthalmologists, pediatric optometrists, or teachers of the visually impaired, those kind of things. And so the kids they're getting help. Many of them are getting help. Not everybody. That's a story for another day. But the ones who are getting help are getting great help, and they're doing their best. But what's going to happen is those kids are going to grow up and they're going to become adults, and then they're going to see people like the optometrists or the ophthalmologists that I see. And if those ophthalmologists and optometrists don't understand CVI, that's a problem, and that's going to be a disservice, as far as I'm concerned, for those kids when they grow up and become adults. They don't necessarily, or I don't know that they'll be able to advocate for it in the same way as I did, because I went from fully sighted to this world of CVI, and I know the difference, and I've seen the difference, and I've experienced the difference, and I can articulate it. Not everybody's able to do that, so this is why I'm beating this drum as loud as I can. Recently, I had a conversation with a lady who works for an organization that is working on this. They've now recognized this as a problem, the sight loss due to stroke, and she and the team that she works for, they have a plan, and I'm so excited about this. She has shown me the plan. She allowed me to give her some input on places where I thought there were gaps, and I'm so excited about it, because it's still in early stages, so I can't say who it is and what they're doing and why, but they're working on it, and that is so exciting, because I'm glad that somebody's finally recognizing it. They get it. I appreciate that she took my input as a person who's lived with it, and I'm so excited to see this move forward. So maybe I'll get to talk about that in another video, but for now it is there. Somebody recognizes it and somebody's thinking about it, and that is a great first step. So that is what I wanted to express in today's video, just the need to advocate more for people who lose their sight as a result of a stroke, more for kids with CVI who are going to someday become adults with CVI. These are the things we need to advocate for. I want to thank you very much for watching today. This one was a bit of a rant, unlike some of my other videos. I apologize for that, but I needed to get it out there because this is so important to me. If you've seen these videos before and you've subscribed already, thank you so much for doing so. I really appreciate it. If you are new to these videos and you like this information, please click like down below, and why not click subscribe and come with me on this journey, because I've already shared a number of videos, but I've got way more topics I want to talk about, and I hope that you'll come along with me. I want to thank you very much for watching today, and I hope you have a wonderful day.